الصلاة والسلام على رسول الله صلى الله عليه وسلم. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Life, the American Muslim weekly show. Today we have very, very distinguished guests with us, Mr. Jyotishi. We're going to be addressing the issue of affecting all of our life. In this program, usually we will address issue of related to our life that cover every aspect of our life: health, peace, community life, our religious practices, every aspect that touch our life, we will be discussing with various guests, as you know. So I'm very honored to have today with us Rajesh Jyotishi, who is president of Salahadin Financial Services, an insurance and financial services agency in Georgia for the last 20 plus years. Mr. Jyotishi is an insurance agent and financial planner in the metro Atlanta area for over 22 years. His expertise in insurance planning and including health and employee benefit. He has assisted thousands of individuals for their insurance need as well as financial needs. He's also the host of many wise columns in Khabar magazine, which is a local community magazine that reaches Indian, Pakistani, Bangladesh community in Georgia and surrounding areas. He's originally from India, but has been living in Atlanta since 1974. Welcome to our show, Mr. Jyotishi, to accept our invitation. And
thank you. Thank you for inviting me, Mr. Wazir. Thank you.
What we'll be trying to address in today's interview is that the hot issues of our time is issue of Obamacare.
Mm-hmm.
First of all, what does Obamacare in general mean to Muslims and non-Muslim and every citizen? Because it seems to be new, revitalized or new change in the health industry. Could you first summarize, and then we'll go to the specific and the detail of what is Obamacare is all about?
Sure. Well, first of all, Obamacare is basically Affordable Care Act that was passed several years ago. Mm-hmm. It just has, earned an acronym of Obamacare because of President Obama, who was so instrumental in passing the act. So what it's about is that starting next year, what the government wants is for everyone to have some at least basic health insurance. Because what happens is that if you don't have health insurance, when we have to go into hospital, there's the social systems have to pay for everything. But if everyone has some basic health care, then at least they'll take better care of themselves, and at the same time be a little bit more responsible in taking care of them, their expenses behind that as well too. So in short, starting next year, January 1st of 2014, everyone will be able to get some basic health insurance regardless of if they have pre-existing health conditions. And in many cases, they'll also be eligible for some government subsidies to help pay for that health insurance cost as well too.
Mm-hmm. Now, just following up more now as we go through the detail on Obamacare, there are some people who are already receiving Medicaid. So those who already receive Medicaid, mm-hmm. in comparison to Obamacare, what is the difference? A. B, if those who are recipient of Medicare, mm-hmm. would they need to have Obamacare? Did that work hand in hand, or how does that work?
Sure. Well, first of all, if someone has Medicare or Medicaid, they will pretty much stay on the same plans. So none of those things will probably change for them. But for people that are in a situation where they don't have any health insurance, they will have an opportunity to get a private health insurance policy to the Healthcare.gov website. Now, when you go to the Healthcare.gov website, basically, you will be putting your information there, and once you put the information there, they would help you determine if you're eligible for Medicaid or any other financial assistance if you're eligible.
Okay. Now, a lot of industrial world, Canada, Australia, Europe, they take care of their citizen with Medicaid and similar to Obamacare, although they don't call it Obamacare.
Yes.
Why is so complex and different in U.S. in comparison to Canadian or Australian or Europe?
That's such a great question, Mr. Wazir. It's so difficult to answer that type of question because, see, America has just been different in the way that it's done healthcare in all these years. So what happens is that, we've had, private health insurance that has been available to everybody all this time. We have had group health insurance, we have individual health insurance, as well as some of the other Medicare, Medicaid type of programs. But there has been no effort as such to have a national type of health plan. So this is the first step. It's not a perfect system yet, obviously. It's just the first step, and we're hoping that as they move along, they'll fine-tune it and make it more accessible for more people. At the same time, the rates will also be more affordable for other people as well too. Right now what we're seeing though is that starting first of the year, many people were actually going to see a significant rate increase, especially if they're not eligible for the government subsidies. So there are some solutions on that we can discuss here in a little bit further as well too.
Now, the government announced the registration to start October 1st. Now they extended because of some problem into the system. Why is it so complex onto the internet to sign up to the system? This system has been spent millions of dollars. So why is so complex, and by this time is not up and running efficiently as it should be?
We don't know. We don't know. They spent about $325 million building the website for healthcare.gov, and there's still some issues. The proverbial word is that there are glitches in the system that they're still trying to fix, and they're hoping that by November 31st it will be working much more efficiently. We don't know if the deadline for enrollment is going to be extended as of now, but right now the open enrollment period is from October 1st to March 31st. But it is a possibility they might extend it, but we just don't know it yet.
I understand you gave an overview or perhaps orientation to hundreds of doctors how to cope and deal with this Obamacare.
Mm-hmm.
What is the mindset of many doctors that you talk to at the presentations that you do?
Well, doctors, obviously are concerned just like everybody else, because the issues for doctors are is that the reimbursement rates for medical fees is getting reduced, obviously. Now there's going to be a whole flood of new people that will be getting new health insurance. So there's a possibility that a lot of the doctors will have a lot more volume of patients that they'll have to see. So from their perspective, that's some of their concerns. Okay. From the concerns of an insurance company, is that now starting next year they have to accept everybody, whether they have AIDS, cancer, whatever ailments that they may have, they have to accept those people with those pre-existing conditions. So they don't know how to price their health insurance plans. They don't know if they're going to accept in millions of dollars in new claims that they'll have to pay for. So many insurance companies are not choosing to participate on the exchange right now. For example, here in Georgia, we only have 5 major health insurance companies that are participating. We have Blue Cross Blue Shield of Georgia, we have Humana, we have Kaiser Permanente, Alliant, and Peace State. So other insurance companies like Aetna, Cigna, United Healthcare, Assurant, they have chosen not to participate in the exchanges at this time. Mm-hmm. Maybe from their perspective, they just want to wait and see what's going to happen and what type of claims and enrollments they're going to see. Mm-hmm. Because the challenge is is that even though there's a penalty, a tax penalty, if you don't enroll next year, it's just $95 per year for an individual, per person. So if the younger population do not enroll into a health plan, they say, I would rather pay the $95 the tax penalty, then what happens is it throws off the law of large numbers. Now what you have is that the younger, healthier population is not enrolling into the coverage, but you have older, maybe possibly unhealthier population that are enrolling, that could cause the rates to go up or claims to go up as well too.
One of the things also that does not seem to be talked a lot in the media mm-hmm. is, and need to be really rightly addressed, is the issue of minorities. there are millions of minorities in this country who may not even properly read English, may not even understand this. Let American, the everyday American who are born and raised in this country already have this complex to understand it.
Correct.
Now, these new folks who are new citizens in the country, even it didn't come to their life yet. When it does come, do you think the government is really equipped well to handle all those immigrant communities? Is there enough resources deployed, have multiple staff who speak Hispanic, Arabic, Chinese, Korean, Japanese, Amharic, you name it, or different languages of the country that are in different cities around the country? What is the preparation along those lines? Any preparation being made, do you think?
I think so. First of all, is that you do not have to go to the website to enroll. You can actually get the health insurance through an insurance agent like myself. You can go to an insurance company directly, and many insurance companies do have multiple language staff as well too, as well as healthcare.gov. My recommendation is this, is that if you can get a good agent, someone that you know that can help you through the process, it's better for you. Because this whole process of getting health insurance is not going to, it's going to be changing on an ongoing basis. So I mean, we have a doctor we go to on an ongoing basis that knows your medical history. You may have an accountant who knows your financial history to help you do your taxes. It's a good idea to make a relations with a good health insurance agent or someone who knows your family needs and can make a recommendation on which plans are right for you. Because like I said, not all health insurance companies are participating on the exchanges here in Georgia. So if you're wanting a plan that is from, say, United Healthcare or Cigna, and you're not eligible for the government subsidies, an agent can tell you which company might be a little bit better fit for you, so that not only for rates, but also for benefits as well, too.
Well, I understand your recommendation is to channel through some of the insurance company that everyone that feel more comfortable. But from the government perspective, do you think the government adequately prepared to meet various communities with their language barriers, with all those? Do you think they're prepared?
I really don't think so in that respect, because the recent poll showed that about 47% of American public, whether it be American English speaking or not, really do not understand how the whole system works. So there is definitely a need for more education, generally speaking, for everybody. Throughout the last several weeks, we get so many calls from so many different people in terms of what is this about? Does this affect me? Do I need to get health insurance? Or, there's a lot of misinformation that is going on there. There's also a lot of confusion.
Although there are some reasonable and valid concerns that are
Absolutely.
out there.
Oh yeah, absolutely.
I think the Obamacare itself is past due, overdue, that this law is supposed to pass 20 plus years ago, because every citizen does need medical coverage. There is no question about it. But why the Republican politicize this Obamacare so much to the point not too long ago they reached to shut down the government? What are their concerns? They're speaking, I'm not saying all Republican, some Republican.
Sure.
They are heavily influenced by a pharmaceutical company and lobbyists. That's why they're opposing, while their good conscience tell them this is a good law that are really affect the life of millions of Americans.
Right.
What is your view?
Well, first of all, we have to look at our current financial situation. I'm a pretty much a bipartisan type of person, so I'm not really one way in terms of Democrat or Republican. But one thing that I have noticed is that if you look at our national deficit right now, we're looking at about $15 trillion roughly in the government deficit. There's roughly about another estimated $50 trillion in unfunded government programs, whether it be Medicare, Social Security, all of those types of things. Now, to fund health care at this level at this time definitely becomes an issue. Where is the money going to come from? What they're hoping for is it's going to come from taxes and also people that are paying higher income as well too. So from Republican perspective, I can see what they're looking at. Because see, if you're not eligible for the government subsidies, Mr. Wazir, what happens is that your rates go up significantly. Just to give you an idea, so my family, I have a $5,000 deductible health insurance plan. And right now we pay around $540 per month for my family. And we're not eligible for the subsidies. If I was to go on to the new healthcare plans that are going to be available after first of the year, my premium would be about $1,000 to $1,200 per year for a similar type of plan. Now, there is a large group of people that actually fall in that category that are not eligible for the subsidies, and they may be looking at that potential rate increase. But what insurance companies are doing right now is to try to defer the effect of the new rates that will be going into force next year. So for example, if you have an individual health insurance here in Georgia, say with like Coventry, Aetna, Cigna, most health insurance companies, what they're doing is that they're giving you an option to renew your policy in December of this year. So it'll be a higher rate than what you're currently paying, but that rate is locked in for you all the way through December 2014. So all of next year you have a higher rate without, a lower rate without having to pay the higher rate for next year. Then in 2015, let's see what happens in terms of legislation, in terms of subsidies, in terms of insurance companies will have more actuarial numbers to see how they can price the plans, and hopefully it'll work itself out in a little bit better sort of way.
Right. The issue, again, I'm not a politician myself, but I understand the politics.
Yes.
But I'm trying to understand the magnitude and the complexity of the issue that they are making a really extremely big deal out of it, to the point they reach to shut down the government, which costs over $25 billion. That $25 billion could have put laptop to every student in America. That could have brought the size of the school to 15 per now 35 per classroom. We had it on Atlanta Journal News not too long ago, various schools talking about their needs. So how do you justify and politicize and shut down the government, and then what change? Are we going to go back again in February, the same issue all over again because of this health care?
I think it's more in line of, obviously there's politics that is going on. And they've actually tried to repeal Obamacare 43 times, which have not.
43 times?
Yes, but it hasn't worked because it is passed as a law. But I think what they're trying to do is to get a point across is that, hey, we have to stop spending so much money, especially when we're in such a big deficit at this time. Because I guess what they're also, maybe from their perspective, what they're trying to do is to say, well, what if there's more and more people that are going to be needing the subsidies? Let me give you another example where, we have a lot of community that come here late in life, say parents of the children and things, people over age 65 who are not eligible for Medicare. See, in order to be eligible for Medicare, you have to have worked in this country for 10 years or 40 quarters. But if you've never worked in this, you're not eligible for Medicare. So, but starting next year, people over age 65 who are not Medicare eligible can get health insurance. Now, will they be eligible for the subsidies? We don't know yet. But but the good news is that they will be able to get it. It'll be very expensive, possibly, just based on their age and everything else. But at least that's good news that they'll be able to get coverage.
Now let's apply the website, say perfectly working. Say come January 1st. Here, I want to pick two scenarios. One an individual case, one a family case. An individual, say, is enrolled into this Obamacare. went through the website and everything. A family of composed of, say, 4, 3 kids, husband and wife.
Right.
That is 5.
Yes.
They are enrolled. Let's pick those 2 scenarios as an example. What does that entail for their life?
Well, first of all, if they're eligible for the government subsidies and they get onto the healthcare.gov, and then basically what happens is that they get health insurance with the subsidized premium. So depending on how many people are in the household, as well as what is their household income is, that is how the subsidies are calculated. For example, if somebody is 4 people in the family, if the income is more than $94,200 per year, less than $94,200 per year, they may be eligible for some subsidies. If their income is more than $23,550 per year, that would basically allow them, the $23,550 would allow them the maximum subsidy based on the current rules.
What is the maximum subsidy in that case, roughly?
It really is hard to calculate. That's
Just
where
roughly.
I really don't know. I could not even guess that.
Okay.
The reason for it is there's an
That's
actual a formula that is there,
Okay.
but it's very easy to figure out though. If you just go to, if you were to Google just subsidy estimator, there'll be an online calculator that you can
What
go.
is that website so our viewers can...
Sure.
What is it called?
It would be
Subsidy
Kaiser
calculator?
KP Foundation, Kaiser Permanente Foundation, or if you were to Google just healthcare subsidy calculators, most health insurance companies also have that on their website too. So if you're with the Blue Cross or Aetna or any health insurance company right now, if you go to their website, you can actually estimate what type of subsidy you might be eligible for. But the best thing to do from my perspective is to actually go get a quote with the subsidy and see what your actual premiums are going to look like.
Okay.
Because
Go ahead.
the reason I say that is that, see, if you know that you're not going to be eligible for the subsidies, and you know that you're healthy enough to get a health insurance right now, you're better off getting a policy before year end so that you can lock in your rates all of through December 2014.
Is the price is locked per year or per what?
Most insurance companies are, giving rate guarantees from December of this year to December of next year.
Say if they locked you up for 1 year, right? And your circumstance change, everybody
Sure.
fluctuate. Somebody that are healthy now may be down the road, something happened.
Right.
So if something happened during those time, well, the insurance company will say, you know what, last year you didn't have XYZ terminal illness, but now you do. We cannot renew your policy. Is that the possibility or no more? with
not
Obamacare?
anymore. Not anymore. As long as you've been approved based on today's rules, they cannot cancel your policy.
No
based
matter
on,
what.
Correct. Now, based on the rules of next year, they can't even turn you down for the health insurance as well.
That would
So-
be the past history, no more.
Correct. So starting next year, I just was talking to a young lady before I came here. She's 7 months pregnant and doesn't have any health insurance. So I told her, well, go ahead and apply for the new plans now. After first of the year, they're going to accept the pre-existing pregnancy. At the same time, the baby can be born with the health insurance benefit,
Including the mother as well.
including the mother as well. Yeah.
Now let's look at the totality of healthcare. Healthcare is not only about some part of the body, that include the vision, the ear, and the dentist. Would that blend it together as a package, or citizen will choose and filter it out which one to sign for? If somebody would like to get totality, vision, dental, and every aspect of health,
Sure.
would that mean what?
Well, the healthcare provisions for the new plans require that some basic essential benefits are included, including some basic pediatric dentistry for children. But if somebody wants dental as well as vision type of benefits, they can always add it on. It's very easy to add on dental and vision benefits onto healthcare plans. There are even some websites like dentalplans.com where you can actually go and compare different dental plans and find a plan that's right for you.
Would that mean cost more money then?
Not necessarily. Most dental plans are not really all that expensive. I mean, usually for an individual, it may cost like $115 to $20 per year, which is not very expensive. Or they may give you a couple of cleanings per year with a small copay, and everything else like root canals and cavities and those type of things may be offered at a discounted rate.
From what you are really telling us and telling the viewer, this Obamacare is something is really exciting and something very good. Aren't the whole citizen and the politician need to galvanize behind the President Obama to support him to make it really work?
Well, I would say it is exciting and for a lot of people, but it's also very stressful for a lot of other people, in the sense that if you're an employer with 50 plus employees and now you have, after next year, you have to offer the health insurance benefits, it becomes a major strain if the healthcare premiums are unaffordable to that employer. So yes, there's always good and bad in every situation, but I think from my perspective, I think it's kind of it's nice to be able to tell someone who has AIDS or cancer or something that yes, they can have health insurance. Tell a pregnant person, say yes, you can have some health benefits. Now, how we're going to pay for it, that we're going to have to figure out as we go, I guess.
I guess we will try to come to the end, and I will have very quickly, in less than a minute, why Georgia did not sign off to this plan?
See, Georgia basically chose not to have our own exchange. So what happens is that Medicare, Center for Medicare Services, is administering the plan for us. Georgia has also chosen not to expand Medicaid, because see, Medicaid is actually ran by the states.
So what does that mean if they did not?
That means that it's also that it has to be funded by the states as well too. So it's also more for financial reasons as well as, I'm sure, politics as well too.
Now, to our viewers who are listening and watching this interview, what would you tell them to pursue and make a very sound decision? And what would you say if you meet President Obama today? What would you tell him? If you meet the House Speaker today, what would you tell him?
Well, that's a tough question there.
We'll end up there.
Sure. Well, what I would say is that, first of all, what you should do from now until end of this year is that you should compare health insurance rates with or without the subsidies. The reason I say that is that if you're healthy and you know that your family is not going to be eligible for the government subsidies, you're better off getting a plan today and lock that rate in for all of next year until December of 2014. Now, if you're not healthy enough to get a coverage right now, then definitely you will be able to get coverage next year for sure. We are offering services in my company at shalinfinancial.com to help you find a plan, give you some rates, quotes, and also help you enroll. So if you need help for that, you're welcome to contact us, and we'll be more than happy to help you as well too.
Go ahead and tell your number. What's your phone number?
My phone number is 770-451-1932, and our website address is shalinfinancial.com, which is SHALIN financial.com. And actually on our website you can actually get instant quotes as well too. But I would highly recommend that you are better off calling us than trying to do it yourself, because it is a complicated process to get the quotes and also do the comparisons.
Thank you very much for your time. And I will say to a member of our audience, as usual, we really thank you for your time and listening and watching this interview. And in conclusion, be well informed, highly educated in any given matter. Be part of the solution to any given problem. Don't be part of the problem. We already have enough problem and complex issues in our community. We need to work together to solve those serious problems that are affecting our way of life. And don't be extreme in any given matter. Be moderate, be gentle, be polite, be persistent, and work together to resolve our common issue And we thank you very much. And please tune in our program, AmericanMuslims.com show on weekly basis. We have updated. And I thank you very much. وآخر دعوانا الحمد لله رب العالمين. May Allah subhanahu wa ta'ala grant us peace, help us maintain peace, work for peace. Without peace, there is no health insurance. Without peace, there is no life. Without peace, there is no education. Without peace, there is no country. So we have to work for peace and keep peace. And thank you, and see you next time. Assalamu alaikum wa rahmatullahi.